Let's check in with infectious disease specialist Dr. Zain Chagla as he joins us with a COVID-19 update. Good morning.
Hi, good morning.
Doctor, COVID seems to be out of the headlines. Everything feels almost back to normal, but of course we're still living with COVID. Do you expect to see a decrease in COVID cases and hospitalizations as we move into the warmer months? More people are outside, and can people start to let their guards down a little bit more?
Yeah, absolutely. Look, the summertime through 2020 through 2021 has always been a time of a bit more calm. As you said, people are outdoors. People can use ventilation outdoors in a way to protect themselves. Doesn't mean that cases are going to be zero over this summer. And there is still a risk of being infected. We saw infections again over the summer of 2020 and 2021. And so people just still need to make those risk judgments. The nice thing is, though, the outdoors creates a nice low risk space that people who are still wanting to be very careful can use in order to still get together with people while reducing their risk even further.
Speaking of risk judgments, 3 health units, Niagara, Peterborough, and Windsor-Essex, they've asked the Chief Medical Officer of Health to reinstate the province-wide mask mandate. So do you think this is necessary?
Look, I think we have good news. The cases are coming down. Wastewater signals are coming down across Ontario, including Hamilton. People know when to mask and when not to mask. And I think, again, we are at a point now where that personal risk decision, especially with vaccines, treatments, and everything else, is just a part of things as much as day-to-day life. So, masks are recommended. They should be worn in indoor settings, particularly places where they're crowded. And again, it's a personal health behavior at this point. I don't think we need to necessarily mandate and cause fines to people for not following it.
Right, and Pfizer is hoping to submit little kid vaccine data for those who are under age 5. What are your thoughts on vaccinating the youngest people we have?
Yeah, I mean, first we need to see the data. There's just a lot of press releases in this context,
right.
and so we really do need to see what the effects are, what the side effects are, the safety, et cetera. Our regulatory bodies are charged with making sure that drugs that come to the market are safe and effective in those age groups. There are a lot of people that are waiting for this, and I think it's helpful for people who want to add another layer of protection for their kids to reduce the risk of severe complications of this disease. But again, I think we need time, we need data, and I think, again, if everything looks okay, then it's time to educate and offer it to the population.
And while the rest of the world is essentially open or opening up, China is still under strict lockdown. So how extreme do you think that measure is, considering that COVID seems to be sticking around with us?
Yeah, I mean, this is the thing, that no one knows what the long-term issue and long-term gains of this are going to be. Unfortunately, with China's kind of COVID zero approach, the vaccine rates in elderly individuals were much lower than the general population. And we saw this, unfortunately, in Hong Kong, where more people died in this last wave of the pandemic than had died per capita in Canada during the entire pandemic.
Right.
And so, I think we do need to give pause here. We know vaccines are effective, but at the same time, this virus is not going to go away. And again, we need to create ways to make sure that society is safe, that the healthcare complications are minimized. And, restrictive lockdowns are probably not a long-term strategy that should be used in this context.
The WHO estimates that nearly 15 million people were killed throughout the pandemic, not necessarily due to COVID, but other factors relating to it, like hospitals being full. So how much higher is that number compared to regular 2 years?
Yeah, I mean, we're seeing 3 to 4 times higher, and really the biggest burdens in South Asia and India during the Delta wave, which really accounted for almost a third of that excess mortality. And so, this just gives us pause. Many people say, well, deaths are higher in high-income countries than low-income countries, and there's a lot of this is reporting errors and death registration. This is a global disease. And again, we also have to be global partners as part of this disease. As again, there is a suffering from this disease globally, both from COVID and the consequences of COVID in that sense.
And I guess we'll be learning from all this data. Thank you so much, Dr. Zain Chagla. Always nice having you on to give us an update.
No problem. All the best.